Hello everyone, this is Dr. Nasser, and in this clip we are going to look at a blood smear from a patient who had severe burn to about two-thirds of his body. You have to realize that red blood cell membrane are very sensitive to heat, and when the temperature goes above certain degrees, usually around 48, 49 centigrade, the membrane loses its integrity and it basically causes fragmentation. So on a patient who has severe burn, you can see various morphological changes in red blood cell. One of the most common are going to be microspherocytes. They are going to be very common, very small, dark spherocytes. And that's because of the loss of the membrane. You also may be able to see various morphological abnormality that there are no names for them. There are fragments, there are perhaps schistocytes. However, any kind of morphological change may be present in a patient who has severe burn to their body. Of course, in this slide, you can see basically two groups of cells, populations of cells. One group is the more normal looking red blood cells, perhaps slightly hypochromic. And the second group of cells are going to be all having these various morphological abnormalities due to the heat damage. Usually these abnormal morphologies will disappear after 24 hours to 48 hours. In this patient, I do also notice that there are a lot of platelets with granular platelets, that they have those granulations, perhaps giant platelets or large platelets in this case. And overall, do have this expectation to see many spherocytes, microspherocytes specifically, abnormal morphological changes, schistocytes, and other changes that we really don't have any names for them, but they may appear like acanthocytes or other type of morphologies that you have learned so far. Again, in this field, you do see the same features, these abnormal morphological changes in red blood cells, microspherocytes, a population of red blood cells that is damaged, and a population that appear more normal. Spleen will clear these fragmented red blood cells within 24 to 48 hours, and you can see a significant change in the appearance of the morphology on the blood smear. However, realize that it all depends on the extent of the damage to the patient, because if there are going to be subsequent blood losses, infections, those all can contribute to abnormal blood smear of a burn patient. So usually the spleen will be able to remove these fragments and abnormal red blood cells within 24 to 48 hours. But again, it's always going to depend on the status of the patient. If the patient have secondary problems related to burn, they may also contribute to hemolysis as well as anemia in patients with severe burns to their body.